Magnetic resonance imaging, or MRI, is a non-invasive imaging technology used in medical investigation. MRIs produce three-dimensional anatomical images of various types of tissues, and these detailed images are used in pathology to detect, diagnose, and treat diseases. The development of MRI has become a stepping stone in the field of diagnostic imaging, especially with the avoidance of exposure to dangerous ionizing radiation. MRI occurs at a subatomic level as it excites and detects the changes in the direction of the rotational axis of hydrogen protons. MRI derives from the technique of nuclear magnetic resonance, or NMR. NMR was discovered in the 1930s by Felix Bloch and Edward Parkle for chemical analysis, which used radio waves and magnetic fields to provide radio signals. In 1973, a technique of imaging was worked on, changing the world of diagnostics by taking a single dimension of NMR to the second dimension of 3D orientation. This was done by two scientists, Paul Lauterbach and Peter Mansfield. Lauterbach was able to develop MRI from his research on NMR, and he speculated that MRI could be used to create an image of body tissues. With this discovery, a scientist named Raymond Damadian produced an MRI of a tumor in a rat and postulated that the magnetic resonance properties of malignant tissues differ from those of normal tissues. And with that, he designed the MRI machine for medical use in 1978. MRI has progressed substantially over the past 30 years, from being an imaging technique with great potential to one that has become a predominant diagnostic technique used for clinical problems. Through the advancements in the research and the clinical application of magnetic resonance technology, we have achieved an increased knowledge based on its functionality. MRI scanners employ powerful magnets that force protons to align with the magnetic field. Essentially, hydrogen protons in water molecules spin on its axis, giving it a magnetic moment, which in turn magnetizes the water molecules of the body. Thereby, when the body gets exposed to a large magnetic field, the water molecules line up and spin at a specific frequency. Additionally, a secondary magnetic field turns and repositions the water molecules. But when this field turns off, the molecules begin to realign, and as they align, their frequency changes. MRI detector coils are then placed over the body to take images of the changes in the magnetic field. The MRI scan shows the difference between various types of tissues based on their magnetic properties, and this helps medical professionals diagnose diseases. Moreover, MRI scans are lauded for detecting demyelinating lesions in various regions of the brain. In turn, this allows the diagnosis of neurological diseases, such as multiple sclerosis. Multiple sclerosis is an autoimmune disease where myelin sheaths get destroyed by inflammation and scarring. These scarring, also called lesions, are plaque buildups in the white matter of the brain, which may impair cognitive function. MRI brain scans demonstrate the demyelinating lesions, which shows the area of the damage. The lesions are presented on MRI scans as white spots. As MRI doesn't have any radiation hazard and continues to advance in its science, increasing awareness of possible safety precautions must also be evaluated before allowing commercial use, to avoid the increasing MR-related cases of injury due to outdated information or inappropriate guideline use. As the static magnetic field continues to increase, it raises questions as to the possible biological and physiological effects that could result from exposure to magnetic fields. These concerns may vary depending on the field of strength of the device, but often occur above 4T. Static magnetic fields are shown to cause various transient side effects in patients such as vertigo, nausea, and metallic taste due to the strength of the time-varying gradient magnetic field. As field strength increases, particularly to those that use 7T, may experience stimulation to nerve or muscle cells as well, potentially resulting from a tapping sensation to severe pain. The radiofrequency waves, RF, also proves risk to patients as it converts energy to heat and transfers it into the human body. Majority of MR incidents are resulted from the RF, commonly in the form of second-degree burns. Materials such as plastic have no effect during the procedure, but any object containing non-ferromagnetic metal, such as implants and pacemakers, undergoes heating and induction, affecting the implant and burning the skin. Acoustic noise is generated from the MR system. While frequency is typically under the accepted range of causing damage, it is reported to cause disturbances for patients. Increasing the anxiety, temporary hearing loss, or simple annoyance creates a difficult space for patients to maintain calm and optimize imaging results. MRI has advanced through the decades at a rapid pace, improving the quality of life for patients in the healthcare system. Likewise, research continues to investigate ways to further advance these devices to improve several features already and not yet implemented in the hopes to further contribute in improving the standard of life for patients. The current problem of acoustic noise is currently prevented by providing dispensable earplugs to minimize the sound, while in future products, implementing gradient designs in the EPI or optimizing pulse reading may contribute in diminishing the problem. Other suggestions, like a type of silencer, has been suggested to improve performance without hindering patients. Other enhancements have been looking to improve quality of scans to allow clear image of anatomy, enabling whole-body imaging to reduce the number of scans needed to be done, and automating analysis could be future investments that will further aid the medical community by enhancing the device and optimizing doctors' time. A paper discusses the future possibility of implementing an AI system to detect abnormal findings within the image, which allows doctors to apply faster testing and allows patients to receive faster treatment. There are future possibilities of improving detection of various diseases such as cancer through the use of MRI scanning to speed up initial cancer diagnosis. The main limitation of these current projects, however, results from the cost of the construction and the use of MRI machines, and evidently, there being not enough of them in Australia today. There is a continual effort to reduce the cost of these devices for both the public and the manufacturers so that it can be used to its optimal capacity.